Hello friends, today we'll know about the topic Ceacum and appendix. These two are the short answers. So first we'll follow up the Ceacum. This is the diagram showing the Ceacum with appendix. The Ceacum continues as ascending colon, transverse colon, descending colon, rectum and anal canal. This can be studied under the following headings. First one is external features, types, position, abnormal locations, peritoneal recess, relations, internal structure, arterial supply, nerve supply. So here you can note as a blood supply, nerve supply and clinical anatomy. So first we'll see the topic external features or general features. See, this is the image of Ceacum, which is a large dilated sac. It is an asymmetrical cul-de-sac. Cul-de-sac means it is opened at one end and it is closed at opposite end. The Ceacum will shows the commencement of large intestine. Along with that, it is also furnished with the tinea coli, which is the special feature of the large intestine. See, these are the bands. Anteriorly we'll see one band. Posteriorly we'll see the two bands on the large intestine. That is a special feature of the large intestine. Those bands are known as tinea coli. This anterior one we call as a tinea libra. Posteriorly two we'll see posteromedially, posterolaterally. Posteromedial band it is known as a tinea mesocolia and posterolaterally we call it as a tinea aumentalis. These tinea are nothing but these are the thickenings of the outer longitudinal layer which is seen in the muscularis externa. So the Ceacum it is also furnished with the tinea coli. These are extended. These tinea coli are extended up to the Ceacum. This is the Ceacum. And now we'll say the location of the Ceacum. You can see in this image. You can see this is the outline of the Ceacum. It is located in the right iliac fossa. See here, this is the anterior iliac spine and this is the pubic tubercle. This is the inguinal ligament. This is the right iliac fossa. Communications. Above, it is communicated with the ascending colon. Medially, it is communicated with the ileum. This ileum will opens into the Ceacum through ileocecal orifice at posteromedially. Then this is the small vestigial organ known as appendix, which is also opened at the posteromedial wall of the Ceacum. Both these opens at the posteromedial wall of the Ceacum. If you see the size of the Ceacum, this size, the length is 6 centimeters. Comparatively, it is more in breadth. The width is 7.5 centimeters, whereas the length is 6 centimeters. Like the Ceacum, there are some organs in our body which are more in width comparatively with their length. Those are prostate, pituitary and pons. Now we'll see the types. Depending upon the shape of the Ceacum, these are the following types. See, this is the first type, that is a fetal type. Here the Ceacum, it is conical in shape. From the tip of the Ceacum, we'll see an tubular elongated part, that is a vermiform appendix. In this type, the Ceacum is conical in shape. In fetus, we'll see this type. So, it is named as fetal type. Second type is infantile type, from 0 to 1 year. Here, you can see the right cecal pouch and the left cecal pouch. So, in between these two, we'll see a depression. From the depression, there is an attachment of appendix. Here the Ceacum shape is quadrate. In its lower border, from the depression, appendix is seen. This is infantile type. Next, third type is normal type. Normally, right cecal pouch, it is more enlarged. We'll see the more enlargement of right cecal pouch than the left cecal pouch. And then this is the appendix. This appendix is exactly 2 centimeters below the level of ileocecal orifice. Orifice is nothing but an opening of the ileum into Ceacum. So exactly 2 centimeters below the ileocecal orifice, we'll say the appendix. And there is a more enlargement of right cecal pouch. This is the normal type. This is the fourth type. I think you can't see this properly in this image. Sorry for that. In this type, here there is a profusely enlargement of right cecal pouch. It's more exaggerated here, double to this size of normal types. Right? This appendix is very close to the ileocecal orifice in this image. So that type, it is known as an exaggerated type. So 4 types of Ceacum: conical, infantile, normal and exaggerated type. Now we'll see the position of the cecum. As I already mentioned that it is located in the right iliac fossa, and then it occupies a triangular area. Above it is bounded by the transtubercular plane. As we all know that this abdomen, it is divided into 9 quadrants by 2 lateral planes and 2 transpyloric plane and transtubercular plane. See the outline of the cecum, it occupies a triangular area. Above it is bounded by the transtubercular plane, below by the inguinal ligament or fold of groin, medially by the right lateral plane. There is any abnormalities during the rotation of the midgut, nothing but any faulty rotations seen in the midgut, the position of the cecum it will varies. Usually the cecum it is developed from the post-arterial segment of midgut. From the cecal bud it is developed, which is seen on the post-arterial segment of the midgut. These are some of the abnormal locations which are occurred due to the faulty rotation of the midgut. First one is a subhepatic position. Next one is right lumbar and pouch of Douglas, left iliac fossa and umbilical region. Like this, it occupies various positions. Next one, peritoneal recess. This peritoneal recess is nothing but a spaces which are produced, spaces or gutters which are produced by the lining of peritoneum. See here, this is the ileum, from ileum to cecum. So this is the superior, from ileum it is going in that direction. This is the superior ileocecal fold and this is the inferior ileocecal fold. So beneath these folds we will see some gutters or spaces, nothing but peritoneal recess. Here we call as a superior peritoneal recess, and here we will find this inferior peritoneal recess. The third one is retrocecal recess. It is nothing but a space which is seen behind the cecum. Entirely the cecum it is lined by the peritoneum. Now we'll see the relations. First one, it is a peritoneal relations. See, this is the cecum, which is a large dilated sac, is an asymmetrical cul-de-sac. Now we'll see the relations of the cecum. First one is a peritoneal. This is the cecum which is entirely covered by the peritoneum, except in 5% of individuals posteromedially, a small area which is triangular directly related to the iliopsoas major muscle. That is a non-peritoneal area there. Next one, visceral relations. The cecum above it continues with the ascending colon. Below it is related to the inguinal ligament here. Anteriorly it is directly related to the anterior abdominal wall, coils of small intestine, in lower margin of the greater omentum. Next, medial relation. This ileum and appendix. Ileum will opens into the cecum through ileocecal orifice, which opens on the posteromedial aspect of the cecum. This ileocecal orifice exactly it opens at the level of right lateral plane and transtubercular plane. 2 centimeters below this junction, there will be the opening of the appendix on the posteromedial aspect. See here, entire this from cecum, ascending colon, transverse colon and descending colon, they are furnished with tinea colon. And these fat deposits are nothing but appendices epiploicae. Posterior relations. See, this is the broad muscle, psoas major muscle, and here iliacus muscle, iliopsoas. So this is the outline of the cecum. Posteriorly, it is related to a one muscle known as iliopsoas muscle. And if you see the vessels, gonadal vessels. In males, it is of testicular artery. In female, it is a ovarian artery. Now, especially on the right side, it is related with the right external iliac artery and nerves. If you see the nerves, this is the genitofemoral nerve, this is the femoral nerve, and this is the lateral cutaneous nerve of thigh. This is also a cutaneous branch coming from the femoral nerve. These two are the branches, are the cutaneous branches of this femoral nerve only. Genitofemoral, lateral cutaneous nerve of thigh. Additionally, we'll see the femoral nerve. So these are the posterior relations. Now we'll see the internal features. We'll see the interior of the cecum after reflecting the anterior wall of the cecum here from anterior view. As I already told you that this is the ileum, small intestine part. It is open on the posteromedial aspect of the cecum through an orifice known as ileocecal orifice. It measures 2.5 centimeters in its width, and then it is having two lips. Upper one, it is having a upper one appears to be horizontal. Lower one is concave. So these two lips meet at its ends. From the ends, we'll see further extension on the left side, which is rounded, known as the left frenula. It is guarded by a valve having upper and lower lips. These lips meet and continues as the mucosal folds, nothing but frenula. This is the left mucosal fold or left frenula, and this is the right mucosal fold, which is long and thin. Left mucosal fold, it is short and rounded. This ileocecal orifice regulates the passage of food from ileum to cecum. Along with that, it prevents the regurgitation from cecum to ileum. Next one, we'll see the appendicular orifice. As of similar with the ileocecal orifice, this appendix, it is also opened on the posteromedial wall of the cecum. This is also an interior view after reflecting the anterior wall of the cecum. You can see this is the ileocecal orifice, which is guarded by a wall with two lips. Then after with the two lips at its corners, these two lips will extend as a frenula on either side. Then this is the appendicular orifice, which is opened on the posteromedial aspect of the cecum, exactly 2 centimeters below the ileocecal orifice. It is also guarded by a valve known as valve of Gerlach. It is a small circular opening. Now we'll see the blood supply of the cecum. It is supplied by the anterior and posterior cecal arteries. These two are the branches of inferior division of the ileocolic artery. See, this is the ileocolic artery, which is coming from the superior mesenteric artery. This ileocolic artery, it divides into superior division and inferior division. From its inferior division, we'll see the branches, anterior cecal and posterior cecal, which passes behind the cecum. Here you can see the dotted lines. This is the ileum and this is the appendix here. We'll see the venous drainage here. As of similar, this cecum is drained into the corresponding veins, which are supplied by the arteries. Those are anterior and posterior cecal veins. Further, it drains into the inferior division of ileocolic, and this ileocolic, see here, this is the ileocolic, and it is drained into the superior mesenteric vein, and it drains into the portal vein. The superior mesenteric vein, splenic vein join together to form a portal vein. This is the ileocolic. Next, we'll see the lymphatic drainage. This cecum, it is supplied by the ileocolic group of lymph nodes. Further drains into the superior mesenteric group of pre-aortic lymph nodes. You see the nerve supply, it is by two types, sympathetic and the parasympathetic. Sympathetic, it is supplied by the formation of superior mesenteric plexus, and it is contributed by T10 to T11. As we can say, in some books it is given from T10 to L1 also. Next one, parasympathetic, it is by the vagus nerve. Now we'll see the clinicals. This cecum, it acts as a guide in operation of intestinal obstruction. If there is an intestinal obstruction, the cecum is bloated or enlarged in its size, so that we can assume there is an obstruction in the large intestine, because the contents may not pass through the large intestine. So we can assume that obstruction will be there in the cecum by its appearance. When the cecum is empty, then we can come to a decision that obstruction is in a small intestine. So this cecum acts as a guide in the operation of intestinal obstruction. Next one is intussusception. Here the terminal part of the ileum, see here, this is the intussusception, this is the cecum, and this is the appendix. This is the ileum, which is opening into cecum. This terminal part of the ileum, which is invaginated into the cecum on itself. See here, it is invaginated itself into the cecum. So that term, it is known as the intussusception.